Hi, this is Scott Pop from Mobility Minute. I want to show you one of my new tools. I call it the tripod, and we use it for lumbar, hip, and mid-back, lower back, mid-back, and hip pain. And we basically make a little tripod out of half-inch PVC. You take a tripod connector, three-way connector that you can get at Menards or Home Depot. You add 2.5-inch legs to it, and it makes this nice little instrument that we can roll up on and work the deep tissues of our hip rotators, our glute muscles, our lower back, and our mid-back. But I'm going to show you how to work the lumbar spine and the hip rotators. It's very effective for mobilizing the tissue of this area. The tissue that is tight in the gluteal muscle and the hip rotators create a lot of lower back problems. And so what we want to do is take the tripod right up into our bony prominence called the PSIS right here, and roll up on top of that and spend a couple of minutes, or about 10 to 15 seconds on each little point. And you're going to search out for tender areas. You're going to work across the upper glute and hip rotators in about 3 spots like this. You can bring your leg down, you can bring your leg up, you can roll it in and out like this, and go way out into the outer hip area. Straighten your leg out, roll back and forth. Just seek and destroy those tender areas. Then you want to get a little bit lower into the deep hip rotators again. Roll up on it, find those tender spots, work those. 3 to 4 different points going out. Go way out into the outer hip. That's going to work the glute muscle and the hip rotators, the largest muscles in the body. Then you're going to get up into your lower back. You're going to put it right to the lateral side of your spine, not right on the bone, and you're going to roll up on it, find the tender spots, move your upper body back and forth a little bit. You can move your leg a little bit. If it's not tender, don't treat it. Roll back out, only spend about 10-15 seconds. Roll up a little bit higher, work the deep muscle, 10 to 15 seconds. Go all the way up into your mid-back. For the purpose of this video, we're going to stop here. It's a wonderful way. You'll find it really loosens up the tissue for simple lower back pain and hip pain. It many times treats it yourself without having to come into my office or go get medication. It's a very effective tool at allowing flexibility in that area. So feel free to make one yourself. Stop by my office. We give these away to patients. Very simple, very cheap, and very effective. So thanks for watching this Mobility Minute.